If you've ever seen addiction up close, you know that recovery isn't just a single decision. It's a long, incredibly difficult path. But what if I told you that path looks completely different depending on how much money you have? Well, today we're looking at a really innovative project in Baltimore that's designed to change that exact reality. So let's just get right into it. The core problem, and it's a big one, is really a tale of two recoveries. It's this deep, deep inequality in addiction treatment, where depending on your resources, your journey can look totally different. And this image, wow, it just perfectly captures that divide. On one side, you've got high-resource treatment. It's structured, it's clear, a step-by-step path. But on the other side, that's the low-income reality. It's scattered, it's broken, it's confusing with no clear direction at all. For way too many people, especially in places like Baltimore, this fragmented path is the only option they have. And frankly, it's a setup for failure. Okay, so that's the problem. But what if we could use technology to build a better, more accessible path for everyone? That's exactly what one group is doing. So this is the Maryland's Recovery Network, and their big idea is to harness the power of something called spatial computing. And look, it's basically a fancy term for using tech like virtual reality to create these incredibly immersive worlds. They're using it to build a whole new kind of therapeutic experience that's engaging, effective, and most importantly, available to all. So you might be asking, why VR? Does it actually work? Well, it all comes down to this one number, 300% plus. That's the boost in patient engagement that clinical studies have found when using immersive VR compared to, just sitting through lectures or reading pamphlets. I mean, we're not talking about a tiny bump here. A jump in focus like that is an absolute game changer for recovery. And this table really breaks down what that 300% difference looks like in the real world. On the left, you've got your traditional care. Think static lectures where your mind can wander, and all your resources are just a jumble of papers. But with the VR method on the right, you're in a fully immersive environment that commands your attention. All the curriculum is in one digital place. And just look at the scale. It transforms treatment from a one-on-one model to one where a single therapist can guide 20 or even 30 patients at the same time. Okay, so this is way more than just a cool piece of tech, right? It's a whole system, and it's brilliantly designed to actually sustain itself. So let's break down how it all fits together. The whole thing is built on these three core pillars, and you can see how they work together, kind of like gears in a machine. First, you've got the technology engine. That's all the immersive content. Then there's the clinical partnership model, which makes sure it's delivered effectively. And finally, the financial ecosystem, which is what makes the whole thing last. Each part needs the others to work. All right, so let's talk about the tech engine first. This is really the heart of the whole system. It's a massive library of their own 30-minute therapeutic episodes. We're talking about a full 60-day curriculum that covers dozens of different recovery topics, all delivered through immersive 360-degree video. Now, it's super important to understand, this isn't about replacing clinicians, not at all. It's about empowering them. This model lets a single mental health provider totally scale up their impact. They can supervise a large group of patients all at once as they experience the therapy together. It's pretty incredible. Okay, and this might be the most brilliant part of the whole thing, the part that makes it actually work in the real world. It's not just running on some temporary grant money. The entire system is built to work with existing medical billing codes, the language that insurance companies speak. This lets clinics bill for the service through Medicare and Medicaid, which creates a financial model that can actually support itself for the long haul. So let's put ourselves in the shoes of a patient. What does this journey actually look like for them? Well, it's a really clear 4-step path. It starts with intake and evaluation. Then they actually use VR to take virtual tours of facilities to find the right fit. After that comes the 60-day immersive therapy program, and it's all followed by a step down into real-world community support. It's a complete, trackable journey. And here's the kicker. The price tag. You'd think something this high-tech would cost a fortune, right? Well, get this. The total budget to launch a prototype, we're talking hardware, development, production, the whole shebang, is less than $10,000. That makes the whole idea incredibly accessible and really easy to replicate in other communities. Okay, so we've got the tech, we've got the model, but this is where it all comes home. This is where the project gets real, right here on the streets of Baltimore. Because it's not enough to have great technology. You've got to get it to the people who need it the most. Their whole philosophy can be boiled down to 4 simple but powerful words. Meet them where they are.
This is all about removing one of the biggest hurdles to recovery for so many people, transportation, by taking the treatment directly into their neighborhoods.
And look, this isn't just some abstract idea. They have actual specific places they're targeting for their Recovery on Wheels mobile unit. They're planning to set up these pop-up clinics in places people already go: libraries, community centers, sober living homes, even food pantries. It's about weaving this support right into the fabric of the community.
So, how does a pop up clinic even work? Well, they've got it down to a science. It's this super efficient 5-step process. A team shows up, sets up a secure zone, runs a group through a 30-minute immersion session, follows up with a peer-led Q&A, and then sanitizes everything and resets for the next group. They can do the whole thing in just a couple of hours.
Okay, I know what you're probably thinking. What about the digital divide, right? How does this work for people who don't have a smartphone or reliable internet? It's a great question, and they've already got it covered. All the VR modules are preloaded, so you don't need Wi-Fi. The devices are locked down, so they only work for the therapy. This means patients don't need their own phone or data plan to participate. They've removed that barrier completely. All right, so let's zoom out for a second. What does all of this really mean? Because this initiative happening in Baltimore, it could have ripples that go way, way beyond just one city.
What we're really looking at here is a powerful blueprint. It's a model for combining low-cost, accessible tech with a deep, community-first approach to start closing these major gaps in public health. This isn't just about addiction. It's about a new way to deliver care and really advance social equity.
And that really leaves us with this one big question to chew on. We're always looking for some futuristic, silver bullet solution to our biggest problems. But maybe, just maybe, the key is already in our hands, using the technology we already have with the empathy to simply meet people where they are.